Let me know when you're ready. Check 1, 2. 1, 2, 3. 1, 2. Hey, hey. 1, 2. Okay.
Oh, it's 2 o'clock, so we will go ahead and start today's press conference. Obviously, today we're here because the numbers continue to rise here in Tom Green County, and we thought it would be important that we share some of the numbers with you today and allow an opportunity for you to ask questions or make comments concerning the recent uptick in COVID cases. Most importantly, what we want to say today is that the number of cases of COVID are significantly impacted because of the unvaccinated individuals here in Tom Green County. In fact, 83% of the most current COVID cases since July 2nd are because of unvaccinated individuals. And I think that tells the story that there are people out there who do not have the same concern for their friends, their family, perhaps their neighbors, and for the rest of the citizens here in San Angelo because they refuse to get vaccinated. We understand that there are concerns that certain people have about being vaccinated, but on the other hand today, I think statistics will say to us that being vaccinated is a much bigger, better choice than being unvaccinated. The total COVID tests in Tom Green County July 2nd was 16,959. And from July 2nd until as we speak, it's 17,359. The number that we don't like to see is the positivity rate, and it is almost 18% as of today's number, so it's 17.9%. And that compares to the July 2nd number of 9.6%. The two age groups are having the largest impact on COVID cases. Is the first age group of 20 to 29-year-olds, and the second is the 30 to 39-year-olds. As of today, there are 20 hospitalized, 2 of which are in ICU. The patients on ventilators, 2, and the patients from Tom Green County, or 75% of those hospitalized, live here in Tom Green County. And these patients, their age ranged from 21 years of age to 89 years of age. Since July 1, there have been totally 41 persons hospitalized with COVID, and 83% of those which have been hospitalized were unvaccinated individuals. That's a pretty big statement. 83% of those hospitalized were unvaccinated. And of course, the number that are vaccinated is a smaller part to the number who've tested positive, which haven't required hospitalizations. and you can be assured a large percentage of those also are unvaccinated. In Tom Green County, the number of people that have been vaccinated with one dose is 44,427 individuals. Fully vaccinated is 39,754. If you take a look at those vaccinated 65 years and older, the number is closer to 90%. So those 65 and older, is close to 90% in Tom Green County have been vaccinated. From July 5th to the 23rd, 1,745 more individuals have been vaccinated. And from April 5th to April 25th, 10,730 people were vaccinated. Since July 1, there have been 341 cases of positive COVID individuals. Of those, 56 were vaccinated. Only 7 were partially vaccinated, and this number is a scary number. 256 of those were not vaccinated. And the information we don't have is those that are under 12 years of age, of course, were not vaccinated, and that's 22 people. Deaths in Tom Green County, 2. Since July 1, 1 who was unvaccinated who lived in Tom Green County, and 1 is from Mexico, so we do not have information or records on that individual. And I want to remind everyone who is eligible for a vaccine, because we need to keep talking about we need you to get vaccinated. So Pfizer, anyone who's 12 years and up may get a vaccination, and we would certainly support that vaccination effort. The Moderna is 18 and up, and the J&J is 18 and up. If you have information concerning those vaccinations, please go to vaccines.gov to find locations where vaccines may be given. And your doctor, certainly contact your doctor. They will schedule an appointment for you. But today, one of our biggest messages is please get vaccinated. You're impacting other individuals here in San Angelo. And certainly July, we've seen more people travel. We've seen more people come into San Angelo. We certainly are seeing a lot more people out and about. The governor yesterday announced that he would not be doing any business shutdowns, nor would there be a mask mandate. So what we're talking about today is personal choice and personal responsibility. And that means that each and every person out there is responsible. You need to take personal responsibility to ensure yourself, your family, your friends, your neighbors, the citizens of San Angelo are not exposed to COVID unnecessarily because you refuse to get vaccinated. I reiterate, there will not be a mask mandate ordered by the governor. There is not going to be business shutdown by the governor, which means the city of San Angelo, the county of San Angelo will follow the governor's orders. We will not be putting orders out there different than what the governor is dictating to us. So once again, it goes back to personal responsibility. We need to keep up the preventive measures. If you have not been vaccinated, at least please avoid large groups. Please continue to wear a mask. And if you're still nervous and you've been vaccinated, please avoid large groups when you don't know if everyone that's there has been vaccinated. Masks are up to you. If you're uncomfortable, put your mask on. We did it for a long time. Most of us got pretty used to it. Did any of us like doing it? No. But I know for myself, my health is important to me. And yes, people who have gotten vaccinated have gotten COVID again. But we want to say this. Those who have tested positive after getting COVID, they're having very mild symptoms and are not requiring hospitalization. And that's key. People have asked about the Delta variant. And the most important message about the Delta variant, yes, it's here, but the treatment for Delta is the very same as the current treatment for COVID. One of the reasons we don't have up-to-date information as it relates to the Delta variant is the following. It takes a very long time to get the test information back. And if you waited to get the information back to treat it, you would be weeks without having any treatment. So the treatment is the very same as it would be for the regular COVID variant. I'm going to open it up for questions, comments. I've got lots of people here who can help answer questions or make comments. Today is meant to be an information opportunity for people, for the media to get out to the citizens what needs to be done. Rick?
Well, I know you pointed out several times that there are those who are not yet allowed to get vaccinated, and I'm talking about my grandkids, 12 and under. What would you suggest about how to keep them protected if they cannot be vaccinated? And second part of that question may be, do you know a date that might become available for 12 years and younger?
Number one, we don't have a date when it will become available, but I do know in reading some information over the past couple days that Pfizer is looking at sooner than later on allowing Pfizer to be given to 12 and under, but we don't have that information yet. And so if Pfizer is, so is Moderna. But my recommendation to you as a grandparent and to your grandchildren is, if you don't know if someone's being vaccinated, I wouldn't let them in my home. I'd be very protective of my home and very protective of where I take my grandchildren, because even though they can't be vaccinated, they can get the virus. Fred?
Yeah, let me follow up on that, Madam Mayor. First of all, thank you for doing this, and thank you for being concerned about the citizens of San Angelo and Tom Crane County. That shows your leadership style, and it's much appreciated. Okay, kids under 12 back in school. The concerns I've heard from most of my friends, and Rick's one of them, but I've heard from other friends too that have kids under 12 in public schools. How is the governor going to assure parents that their kids are safe when we don't even know that all teachers are vaccinated? There's nothing to check to see about that. How is the governor going to assure parents across the state of Texas that their kids are safe under 12 back in public schools?
What I've read and the comments I've heard from the governor is it's up to you. It's up to individual
and I appreciate
citizens.
That, but I send your kid to school with a bunch of kids under 12 years old and nobody's wearing masks, and you tell your kid to keep it on. It's not going to happen.
I think that's a good statement.
No, my question is, how is the governor, since he's not going to do a mask mandate in the public schools, how is he going to assure parents that their kids are safe? He can't.
He cannot. He does not have, he cannot be everywhere, every place.
Can we as a city and you as mayor prevail on him to use masks in schools for kids under 12?
I think the number one thing we need to do is to visit with Carl Detloff, head of SAISD, number one, and ask him that question.
But you're the mayor. You would have more influence than Carl Detloff would.
Well, I might have more influence, but I'm a small community of 100,000 people.
Oh, I understand.
And
I
so
understand.
what we really want to make sure is that he hears our voices and understands our concerns.
My concern, and you can hear it, my concern is we're adults and we can choose to wear a mask or not. I mean, whether he mandates it or not for the public, it makes no difference to me, because I'm going to do what I do. But for children who are not allowed to have a vaccine yet, it's not right. And that's where the parents' concerns are, I can assure you.
I don't blame them. I would be concerned too.
Thank you, Madam Mayor.
I think we all have to keep our voices loud and continue to communicate issues and challenges that we have as a community, whether it's a parent or as a grandparent, and make sure that someone making these decisions is fully aware of the impact that decision has on the rest of our society here in Texas, including the kids who are
Thank you,
vulnerable.
Madam Mayor, and I appreciate your concern, and I know where your heart lies.
Thank you. John?
Thank you, Mayor. John Tuff, San Angelo Standard-Times. Is the city doing any coordinated efforts to reach out to certain demographics or populations within San Angelo to hold additional vaccination clinics, such as the city's homeless population?
Yes. I'm going to have Sandra maybe or Teresa talk about the homeless population and what we have done, but the city does and is giving vaccinations to those people who are uninsured. And we have a homeless coalition, which we're working with a homeless coalition to try to get as many people vaccinated as possible.
And you've touched upon this already, but what we're hearing from some groups of unvaccinated people is that if people who are vaccinated are getting sick, why should I get the vaccine? What's your message to them?
The message is the following: you may get the COVID again, but you will not have it as seriously as if you aren't vaccinated. So the point is, I am totally vaccinated, 2 doses of Pfizer. If I get it again, my symptoms will be less severe, and I probably will not be hospitalized, unlike this person over here. If they are not vaccinated and they get it, they could become one of the 20 that's in the hospital today, and particularly if they got the Delta variant, could be very sick. Next question.
Matt Trammell, San Angelo Live. So first, if we look back a year ago, we would see numbers 100 per day, and now we're worried about 200, 300 active cases. What's the sudden change of why this call meeting when we aren't reaching hundreds per day?
The reason we're having the meeting today is because even though we're not reaching the same numbers that we were reaching 6 months ago or 9 months ago, if you compare those numbers to February, April, and May of this year, they're significantly higher. We've had many people ask the question about whether the governor was going to ask to have a mask or demand that a mask mandate be enforced. What we're trying to do today is just plead to everyone about the vaccinations. You know, you look at the numbers in April and May, they were very low. And if you look at the percent increase from April and May, the increase is huge compared to that. Are the number of cases substantially? Yes. But I believe if we're not communicating early on about what is happening with it, meaning the number of people that have tested positive, a large majority of them are unvaccinated. It's us trying to tell the community what's going on.
So another question I have is, do we know, have health officials found what is maybe causing the spike? Because there are more people getting vaccinated every day, which means there should be less people that should get COVID. So if it was going down, why now the drastic spike?
We were having increased number of vaccinations for many, many weeks and months. All of a sudden, the number of people getting vaccinated decreases every week. So even though the number of vaccinated that are 65 years and older is at a high number, if you look at the Tom Green County numbers, the percentage being vaccinated is less in Tom Green County than in the state of Texas.
Okay, and I just want to, because a lot of people just kind of really need to hear the reiteration of last time there were businesses closed down and masks worn, the governor said there's no masks. I just need a reiteration.
No masks. No mask mandate.
All right, thank you.
But we here in Tom Green County, our statistics are not as good as the state of Texas, meaning the state of Texas, and we're a huge state. I mean, put this in perspective. It's a large state, and our number of percent of people being vaccinated is less than the state of Texas. That's of concern.
Due to Governor Abbott, the city of San Angelo can't shut down businesses. It can't enforce any kind of mask mandate.
Correct.
But will the city consider limiting the number of venues or the number of events that it allows to host as a means of limiting the people who are unvaccinated who might interact?
At this point, we have not discussed that. If we continue to see the number of cases continue to go up, we might have to take some corrective measure that does not get in the way of the governor's mandates and his executive orders. But what we really want the message to be right now is get vaccinated. Get vaccinated. That's our story. We need to get vaccinated. How could we in Tom Green County have a lower percent of the population unvaccinated? That number doesn't make sense to me. It tells us that there are too many people who are not as considerate of others in the community. And remember, right now, because it is summer, lots of people are coming into our community. Lots of people outside our community are coming into our community that could be unvaccinated. So they're impacting our community. But even with that said, our numbers of vaccinated people are lower than the state of Texas. That's concerning.
You've said it several times, but I think it needs to be reiterated that although the governor is not mandating masks, he is also not saying you can't wear a mask.
That's right.
So I think that needs to be a personal decision as well. And if you're waiting for the governor to tell you to wear a mask, common sense.
Personal responsibility. And if you have not been vaccinated, please wear the mask. If you have such a problem with getting vaccinated, please protect others. Avoid large groups of people. Put your mask on. We ask this of citizens.
Matt Trammell again with San Angelo Live. So since y'all do have the numbers, you said them earlier, are we going to start seeing, with the daily COVID counts, people who are vaccinated or unvaccinated?
We will start doing that. I asked the Shannon Hospital to start reporting those numbers to us. Up until this week, they had not really on a daily basis looked at vaccinated versus unvaccinated. Shane Plymell has committed that they will really focus on that so that we can make the public more aware on an ongoing basis.
And is that for deaths too? Will that be released for deaths too?
Yeah, as long as it was in Shannon Hospital,
Okay,
yes.
thank you.
Or I assume we would. I'm not sure if the information concerning one's health is something we can publish, but we're going to try to get as much information out there as we possibly can. The citizens need to know what's going on in their community.
Hello, Jalen Lewis with KSAN KLST. I just wanted to ask the question, just if there was a surge of hospitalizations, would Shannon or our hospital systems here be able to handle, are they properly equipped to handle that type of surge?
They're very equipped to handle that surge. Even when we were up to over 100 COVID cases, they had the capacity. So we're not worried about the hospital capacity so much. Our biggest concern is the number of unvaccinated people that are being hospitalized and impacting the rest of our community.
Perfect. Thank you.
Adriana Alexander with Fox West Texas. How are you guys regulating tourists that are coming to Tom Green County and San Angelo to make sure maybe they're vaccinated or they're not, and how you guys keeping account of who is coming here?
We can't. We don't have roadblocks at every entrance into the city, so there's no way that we can come up with that information. I would assume if you are a group that's sponsoring a tour of some event, that you're somewhat aware of what's going on in your group. I mean, because you've got people in those groups that are going to be concerned about who else is in the group. If you've got a tour group of 65 and older, chances are most of them are vaccinated. But again, we don't have that capacity and capability.
Thank you.
Brenda, let me ask you, and you may not can answer it because it's a medical question, but okay, I've been fully vaccinated, okay? Let's say I contact the Delta virus, and I've read of cases or heard of cases where they get the Delta virus and really, really are symptomless. Okay, so say I have it and I'm not that sick. Can I pass it on?
Of course, now I'm not a doctor
Tom
as well.
is shaking his head, yes, okay.
And he says yes, and I've
good,
read it.
Good,
yes.
yeah, because that's been one of my questions, that you can't.
I've read it
okay.
too. If you've got it, you can pass it on, vaccinated or unvaccinated.
Okay.
The most important
All the
part
more
is you're
reason to
not
wear the
going to
mask.
be as sick.
To protect someone
Yes.
else. Okay.
Yeah. And meanwhile, I want to talk about the people I have here supporting this press conference today. One is Tommy Hebert. I keep saying Larry King, but it's Larry Miller. Your name, please. Mr. Luke from Goodfield Air Force Base. Nade Sethett from the county. Lucy Gonzalez and Harry Thomas, all city council members. And they too wanted to be a participant in this press conference today, as everyone in their district is quite concerned about what's going on in the city, and they're here to support the city in all of our efforts to get this communication out solidly to our citizens. Go ahead.
How you doing? Manny Diaz with San Angelo Live. We had a viewer chime in on our live stream asking, will we get statistics on the Delta variant cases when this information is known?
We will get it. As I said, one of the biggest problems in talking to Shane Plymell yesterday is the very long time period it tests to get that information. He said it could be 3 weeks before we get it. So that's one of the reasons why we do not have current information right now. We do know it's here in the city, but we don't have the number of cases.
Once again, Matt Trammell, San Angelo Live. So you said that one of the deaths that occurred during July was a resident of Mexico.
Yes.
Currently, as we all know, the illegal alien surge that's going down at the border right now has that affected San Angelo, or is COVID cases being brought in by anyone that's not supposed to be here?
Number one, I don't have statistics on that. I will say with that, we as a city have not had the same impact on what's going on the border as other cities south of us and west of us have had. What we don't know is if the one from Mexico that passed away, whether they were legal or illegal. We just know that they are from Mexico. But we have not had the surge of illegals, as far as we know, that other cities have had. And we don't have a facility housing those individuals right now. So obviously the impact would be less. Daniel, would you, the city manager, would you like to offer any comments today?
Mayor, I think you've done a wonderful job covering everything. One of the things that we've always done, of course, is we still continue meeting with the medical professionals every Monday and the community leaders as well. So one of the things that we've always focused on is, of course, making sure that, and the mayor talked about it a little while ago, is minimizing those individuals that are hospitalized as well. We never want to get to the point where we're stretching resources. So again, getting vaccinated is, again, the biggest message that we have. So please get vaccinated.
Several months ago, we made sure that we contacted all of those larger corporations here in San Angelo, the larger business, and did vaccination clinics at their facilities. I think that we will start again with another list of facilities that we might need to go back to, and once again set up vaccination clinics in some of those businesses and see if this go around people change their minds about wanting to be vaccinated or not. Any further questions or comments? And further questions or comments from anyone up here? Okay. With that, we'll call this to a close. But again, the message is get vaccinated. Be responsible, get vaccinated. Let's take care of this community, and let's not let the state of Texas do a better job at getting vaccinated than the city of San Angelo and Tom Green County citizens. Thank you very much. Good job. Thank you.